Hello, everyone. I'm Kara, and I want to welcome you to Pharaoh's Health On Demand webinar series. October is recognized as Health Literacy Month, and you may be a bit shocked to know that 9 out of 10 adults struggle with health literacy. Pharaoh's Health is passionate about boosting health literacy through our Enlight platform and also through education. And today I'm so excited to welcome an incredible guest, Dr. Cristin Dickerson, where she'll be walking us through how to shop for healthcare. When you stop and think about it, generally speaking, we're all pretty savvy consumers when it comes to most things like buying a car, even booking a vacation. But for healthcare, it's a little different. You may be surprised to learn that prices vary drastically and that high costs don't always equal the best quality. So there are many things that we can do to become better consumers of our healthcare. And again, excited to have Dr. Cristin Dickerson from Green Imaging on with us today to present some great information. Thanks again, Cristin. Dr. Dickerson, welcome.
Thanks for having me.
Absolutely. So we're thrilled to have you presenting today. It's great to see you again. For our audience, I had the opportunity to meet Dr. Dickerson back in the summertime, where we were both at an event with a group whose mission is to bring quality and transparency to healthcare. And Dr. Dickerson, you were one of the panelists. And what really stuck with me was the fact that, number one, you were really dedicated to quality patient care at a fair price. And then the second thing that stuck with me is you had given a stat around the fact that the cost between being diagnosed with stage 1 cancer versus stage 2 cancer, not even considering all the pain and suffering difference, but the difference was like $100,000. And that just stuck with me. So at any rate, I'd love to turn it over to you. We'd love to hear about your background and, what led you into this area of just wanting to bring transparency and care at a fair price to patients.
Fantastic. Hi, great to be here. I'm Cristin Dickerson. I am a practicing radiologist and CEO and founder of Green Imaging. I founded Green Imaging 14 years ago to solve a problem in my community, which was there was not affordable imaging. The chain of imaging centers that was operating in network was purchased by a hospital system, and the prices overnight tripled. And so, the same exam, same machine, same radiologist reading it, the price suddenly tripled. And that's what hospitals and that's what private equity do to the cost of healthcare. And so I founded Green Imaging. I actually worked with the imaging centers that I was reading for that were at 50% capacity, bought the excess time on the table that the machine was running, but there was not a patient on it. Had the scans pushed to our PAC system. That's where radiologists read the studies. We read the study and we offered a fair bundled price for the exam. Started doing that 14 years ago. We're now offer imaging at over 5,000 facilities nationally. And I know a little bit about shopping for care, because where we don't have a contracted facility and we have a member covered by their health plan who needs care, we go out and shop for care. And it's trickier than you might think. So the first thing to understand about imaging and surgery is that it's not just one code or one exam that gets charged. There are frequently multiple codes associated with the same exam. Those are called CPT codes. And there's frequently a facility fee, and that's the fee that the imaging center or the hospital charges to do the scan. And there is a professional fee, which is what the radiologist or the surgeon charges for that, their professional service. And there also can be what are called HCPCS codes, and those are the contrast and the radio tracers and the surgical tray and the medicines that are required to accomplish, either the imaging exam or the surgery. So you really have to know going in that you want a bundled price, what's called a bundled price. That's everything all in. And most of the time, when you get a price at a hospital, you're not getting a bundled price. So be very aware of that. We have been shopping for care for over 10 years, and we find all kinds of surprises. The biggest surprise right now is the cost of care. Over the past 4 years, really since COVID, the cost of care, and that's been since inflation has gone up. Inflation in the imaging space and in the healthcare space, both of those spaces, has outpaced the grocery store. If that's possible to believe, the imaging inflation has outpaced groceries and other commodities. And so, whereas mammograms, and the other thing that's happened with mammography is 3D mammography has become really replaced 2D mammography. Most imaging centers and hospitals that invest in a 3D mammogram unit want to get it paid for, and so they have to charge more, and so they only offer 3D, even though 50% of women don't benefit from a 3D mammogram. If you don't have dense breasts, there's no added sensitivity. But most of us can only get a 3D mammogram. So the average for when we look at large sets of claims data and look at the prices in somebody's healthcare network, what their employer or their health plan is paying for the exam, the average for this client was $650 for a mammogram. We all think, oh, $250, $300 is probably what I'm going to end up paying. And, it's doubled over the last few years. An ultrasound, this one I found quite shocking. Ultrasounds, I would have thought I could get an ultrasound at a hospital like I did when I was having my kids, in the $250, $300, $400 range. For this client, they were paying for almost $1,400 for an ultrasound. What that means is a woman with a lump in her breast who's not going to be covered for the screening mammogram because it's a diagnostic mammogram, there's a symptom there, is going to be paying almost $2,000 out of pocket if she hasn't met her deductible to get this worked up. That is a lot of money. CT scans have, I typically see between $1,000 and $1,400. But this is patients who go down the hall at the hospital. In this case, the total claim was $9,000. The plan paid $6,000 and the member paid $3,000. So this happens in your health plan, and it's very difficult to control. 3T MRIs, children's hospitals charge in the $7,000 range. If it's with anesthesia, if a child requires sedation for it, it can be $15,000. We were able to get this child taken care of for $700. PET CTs, we're getting more and more exotic tracers that are driving up the cost of these. The average for this client was $10,000. In our network, we're able to get these for $1,400 to $3,000. And then one of the things this is an example of the pharmaceuticals. This is actually radiographic contrast, the contrast that's used with a CT scan. And although one of these was $390, that's still a lot of money that we can get whole CT scans bundled for $390. This one was actually $8,000. So the member, I think it was charged at $23,000, allowed at $8,000, and the plan member picked up a significant portion of that. Patient still paid $1,700. So these are financial crises for people. So you really have to be attentive to the fact that you do need to be shopping for care, or you can end up with one of these. You can end up with a bill from a hospital, and it can be really devastating to your family's financials. There's supposed to be these consumer protection laws in place, but they're not really being enforced. This one is the HIPAA omnibus rule. You have to use it in your favor. We all think of HIPAA as a privacy rule, but one of the things it allows is that it says that a patient can withhold their personal health information from their insurance company, go out and shop for a self-pay price for something, and that their insurance company never has to know about that. And somebody else, like their employer, can also shop for care for them outside of the health plan. So this really protects, and what you'll hear sometimes is that your doctor's office may say, no, you're in network. I can't give you a self-pay price. You actually have a right under this law, and you have had for 11 years, for that doctor to pay, for you to pay that doctor the self-pay rate, and he he or she not send anything to your insurance company about that. The hospital transparency rule is even harder. Only I think it's 34%. I've got a statistic, maybe 36% of hospitals are really complying. And what you need to be aware of here is they're frequently not giving you the professional fees. They don't even know the professional fees. And frequently they don't even know who's going to provide the professional service, which would make it hard for them to quote that anyway. So they are supposed to be, disclosing this on a website, giving you a realistic estimate of cost sharing liability, but you got to be really careful about those estimates. They are truly estimates. So the full compliance rate is 34% right now. It's, that is 2 out of 3 hospitals are electing not to be compliant. And the reason is the penalties are so low that it's easier for them to not comply. And there's also the No Surprises Act. So in this situation, if you get an out-of-network bill, from a provider at an in-network facility, you have a right to fight that. If you get emergency care from an out-of-network provider, you have a right to fight those bills. And then air ambulance is the third one. So this is something that you need to know it's out there. And if you get one of these quote unquote surprise bills, you need to go do your homework and see if you can't mitigate some of those costs. The cost estimates that you get from hospitals, you need to be really careful. And they're usually 2 pages with a lot of disclaimers, and you need to read every word on those estimates. The estimates frequently don't include professional fees. The hospitals also will say this is a self-pay rate. But then they use what are called scrubbers, which are software. When a patient comes in from an auto accident, doesn't have a wallet on, and they don't know if this patient's insured, that, they don't know anything about the patient. Maybe they've got a little bit of ID from somebody. They use scrubbers to find that person's demographics and find out if they have insurance. And what they are doing is using these scrubbers actually illegally. It violates HIPAA. They're using these scrubbers to see if patients who are coming to them as self-pay actually have insurance. And in that setting, frequently, and again, this is not legal, but they do it, they will charge a higher self-pay rate if a patient actually has insurance. We see that all the time. And there's also $400 leeway in these estimates legally. That's a lot of money. That's more money than most people have to spend on healthcare. So that $400, I've seen it where there were several CPT codes, several codes being quoted, and each of them ended up being charged more for $399 more than the member was quoted. And then again, they won't offer any self-pay pricing, or they offer a higher self-pay rate if the patient has insurance. So there are strategies you can use. You can find knowledgeable providers. There's subscription-based primary care where doctors steer to lower cost situations for imaging and surgeries and specialist visits. Another is an employer health plan that has knowledgeable platforms, knowledgeable navigation specialists that has resources in place, like you have with your health plan to, these people can help you find pricing and can help fight on your behalf. Also, if you're getting pricing from a hospital, if you're getting pricing from a doctor's office, document it, get it in writing. Even if it's an email from them, in the state of Texas, anything, even a verbal contract is considered a verbal agreement is considered a contract. But in most places, if you have something in writing, that is an actual contract. But do be aware of any disclaimers on that communication. If you need somebody's help, what they'll tell you is we have to speak to the patient. You can't get a pricing for this patient. We have to speak to the patient directly. You can get a limited power of attorney. It's a paragraph long form, and somebody can negotiate on your behalf. Don't let people bully you into saying that you're the only person who can get pricing. And educate yourself about data scrubbing. Understand the only things that they have the right to access are your name, date of birth, and the CPT code. Those are the things in order to give you pricing. That's all you have to present. You don't have to present insurance information. You don't have to present anything else. And so, understand that if you provide more than that, they're going to be looking in the background and trying to assess whether you have insurance or not, and you may get a higher quote than if you assert your rights and just give them the needed information. So these are things that we've discovered along the way about shopping for care. What we do is we shop for care for individuals, and your health plan likely has things in place that can help you as well find more affordable resources. Know that costs have gone up dramatically, and you may get bills for several $1,000s if you haven't met your deductible from hospital systems. Be careful of hospital systems. Be also careful of facilities that are down the hall from your doctor. Sometimes those are joint ventures with hospitals or are owned by hospitals. So, be aware of who owns the imaging center. Is it independent or is it hospital based? Do they have any affiliation with a hospital? Those are all really good questions. And then imaging, if you negotiate with an imaging center or an ASC, an ambulatory surgery center, which is a better and more affordable place to get a surgery. If you're negotiating with those, you want a bundled price. You want everything in there. If not, you want to know who's going to be providing the professional services, and you have to go get a price from them as well, or you're not going to know. We sometimes see professional fees exceeding facility fees these days. And that's because private equity is aggregating radiologists, they're aggregating surgeons and anesthesia groups, and they're just the cost of care goes up. So don't be scared. You have rights, and the law is behind you. But do go in as an informed consumer when you start shopping for healthcare, and you'll come out a lot better.
Yeah, this is really helpful. Thank you so much. I'd love to, I've gathered some questions and was thinking we could talk through those. So talk to me about the facility fees. So a lot of times people don't understand, if you go to urgent care, you could have used that free telemedicine benefit that your employer provides and probably had a much better experience and a great result. But how do we help support, employees and, patients and our families with getting to the right place for care?
One of the scariest statistics I heard last week, I went to 2 conferences last week, and one of the scariest statistics that I heard is actually 2 times as many people die of infections acquired visiting a hospital as in a car accident.
Wow.
And these are, antibiotic resistant staph infections. And so, number one, stay away from a hospital for routine care or care that can be done elsewhere. That's a really scary, think about everything we do to avoid car accidents.
Right.
And we go visit friends at the hospital and new babies, and people go get their colonoscopy there that doesn't need to be there, their orthopedic surgery, their imaging, all of those things don't need to be done in a hospital. And so I think the very first strategy is get it out of the hospital. The second is get the care you need so you don't end up in the ER. And that's one of the things Green Imaging does. We have a fairly redundant network, and we have a pricing spread. In Houston, we might have MRIs ranging from $350 to $700. But if that $700 MRI keeps you out of the ER, or a CT in that price range keeps you out of the ER on a Friday afternoon, that's an amazing thing. And it's going to be a lot cheaper than going to the ER. So get your care, find trusted resources, understand, what your health plan offers as far as primary care, telehealth. Some are offering urgent care situations. My employees all have what we call advanced primary care, and it's a subscription-based primary care. They and their families have that covered, under our health plan, and they also have urgent care and in-person primary care, 12 hours a day, 7 days a week, and then they have the telehealth, mental health, 24/7. And so, even though you might not need it right now, understand what you have in your health plan so that when you do need it, you're not in crisis.
Right.
That's probably the best tip you can take away from today is really wrap your head around, because what we get is we get people in crisis and they're not listening to us, and they're not hearing that if they drive 20 minutes down the road, from the hospital, they're going to get this zero out of pocket. Whereas if they keep it at the hospital, it's going to be subject to copay and deductible. And
Right.
the other thing I learned this week is that there are two different types of family deductibles. One of them, in how it accumulates and how much of it, whether the co-insurance you're paying along the way and things like that end up in your family deductible, makes a dramatic difference. So you may think you understand your deductible and where you are, and you may be absolutely wrong. So the other thing is to really get a good grip on where you are if you're planning on staying at the hospital, because you might think you've met your deductible and you haven't.
Okay. Yeah. And I think the biggest thing that you've mentioned multiple times, and it's one of our goals here at Pharaoh's Health, is to let people know they have rights, right? Like they have a voice, they have a choice. And that's one of the things we're really committed to showing is a non-bias, because we're not owned by a health plan. We're not owned by private equity. We're not owned by a health system. We are just giving everyone, here's a view of all your options. Here are the quality costs and customer experience part of it, so you can make an informed decision. But I liked what you said, because a lot of times people don't know. They just, for so many years, we've just said, oh, go down the hall to this radiology. Oh, okay, great. Or go over here to get your blood drawn, or to this lab, and you're okay, great. But now it's just getting to the point where it's not sustainable from a cost standpoint.
Yeah, the old joke, where's the most expensive place to get an MRI? And it's down the hall at the hospital.
Yeah, definitely. Can you talk a little bit about the fact, I think a lot of times we think, oh, if I pay more, I'm going to get the best care.
Right. There's actually an inverse relationship in this country between cost of care and quality. And so, some of that is infection rates in a hospital being so much greater than in an ambulatory surgery center. But, it is, I don't want to consider imaging and surgery a commodity, because they're not. And you should, the thing when people start saying, how do I assess an imaging center? So the first thing you do is you go on their website and see if they talk about who their radiologists are. If they don't, I wouldn't touch them with a 10-foot pole. Being proud of who does your professional services is super important. And so I think, looking at infection rates for surgeons, looking at the training that radiologists have had, making sure that you're going to have a subspecialty, if it's appropriate, you're going to have a subspecialty radiologist reading that study. Things like that can make a dramatic difference in health outcomes. So I think those are much more important than cost. And all the time people say, I just don't trust something that's that inexpensive. But that $350 MRI that we offer in Houston is, the Baylor College of Medicine advanced imaging guys went out on their own and built their own system. It's a brand new Siemens magnet. They're the best in the business, and it's a very nice facility. And so that's, again, where that inverse relationship comes in.
Right. Well, we're feeling optimistic here at Pharaoh's Health because, there is this movement for transparency, for allowing people to understand they have rights, and then providing them with tools so that they can self-serve. And then, obviously we're working with great employers that are really dedicated to getting their employees better care, more affordable care, and just wanting employees to get the care. I think I read something recently where almost 40% of people are delaying care because they're scared. They don't know how much it's going to cost. They don't know if the quality is any good. And so they push it off, which obviously is not a great strategy. We're feeling optimistic, but I guess my question for you is, are you feeling optimistic with healthcare in general? Are we heading in the right direction from a patient standpoint?
I really feel like we are. Health Rosetta is a movement in this country where they're really working with employers and what were traditionally healthcare brokers, people who sold insurance, and they're having the brokers instead work as consultants and really find solutions like yours to put in, and like mine, to put in health plans that provide more affordable options for people. And, I would say the size of their conference this year doubled. The number of employers who received awards for not only saving money, but actually giving that money, they have to also give the money back to the employees or the or the community in which they live. That's the number of employers engaging in this. And I'm seeing larger employers engaging in this. The average size of our clients probably tripled or quadrupled this year. And so that means that we're getting care to more people. I love serving individual patients on a self-pay basis, but the way we really impact things is getting to groups of people. And that's how we really change healthcare in this country. I see the momentum growing. And, at a certain point, it's going to be a downhill ride for all of us who've been really trying to change healthcare. The system is so broken, the old system. We've just got to make sure the new healthcare economy works well. And, that's what I fight every day to, I really try to make it work well for doctors. That's really my passion, that they get paid fairly, they get paid promptly, and all the shenanigans that have gone on in health plans and in hospitals for so long.
Right.
Solved so that we can make this right. If we align this for employers and patients and doctors, we've really created a system that nobody can go back to the old system. Now they're going to try because there's so much money in the old system.
Right.
But when you start talking about better care and better access, I think we're getting the momentum to get us there.
Great. Are you seeing, I was thinking back, I was on site with some clients and they were talking about how someone dealing with a chronic condition was seeing a medical doctor and then was turned over to an NP, to a nurse practitioner. And then they were going in for a follow-up again for a chronic condition. And they got a call saying, oh, the nurse practitioner has left and we can see you in February. And this is in August for a chronic condition. And are you seeing people start expanding that search for healthcare and getting out of their little community? Because especially in rural areas, there's such a lack and there's been high turnover, but are you seeing more of that destination healthcare or people expanding out outside?
Yes, I think you have to do that. There are communities where the rural hospitals are starting to work with the local employers. But they're also, the ones who are standing up with and saying, absolutely not. And you're not going to impose reference-based pricing on us. You're not going to put these discounts on us. We're not doing that. And a lot of those are closing down because of that. And that's causing access to care issues. Yeah. I've had people from Alaska jump on a Southwest Airlines flight and, for $500 come to Houston and get their MRI for $350 and go back, because it's so much cheaper than getting care there.
Yeah.
And so I think you do have to think, and I think surgery is the same way. Texas Medical Management is a great option, and a lot of their patients come in from elsewhere to access their transparent bundled prices at ASCs for surgeries.
Interesting. Well, good. Well, again, not to tout the Pharaoh's Health and Light platform too much, but one of the cool features is you can expand it outside of your area. So it's specified to the health plan that you're on, but it also can expand across the country, which is also great if you have a college kid like I do outside of your area and you're trying to find care. But yeah, I've heard a lot about, hey, I actually got a vacation, came from Alaska, was able to enjoy the great weather in Texas and have my surgery or get my imaging done. So I think we're going to get really creative. And I think all of these things are really helpful in going along to becoming better shoppers, more savvy shoppers. And hopefully we can start choosing healthcare, in a smarter way because we have more information so we can truly make informed decisions. So.
And
Yeah.
I think finding great resources like yours to help you is really, it's a struggle. And when somebody's already done the labor for you and, aggregated the information, it's like going to Amazon.
Right.
You're doing the same thing. You're still comparing pricing, but you've got much, much better access to opportunities.
Absolutely. Well, we really appreciate your time. We appreciate you kicking off Health Literacy Month for us. Again, super important. Any thoughts on that? Again, 9 out of 10 is just I mean, truly shocking, but I've been in healthcare for 10 years. I am not a clinician, but I still struggle choosing a health insurance plan or understanding my benefits or out of pocket. Like, any thoughts on that?
Yeah, I really do because, 9 out of 10, but it's really 10 out of 10 when people are under healthcare stress. And that's why, that's well, Green Imaging, we originally built an app that people could self-schedule. The problem is people don't know what they need, and especially when they're under healthcare stress. And so we have a very robust concierge service that walks people, through the process of finding care. And so I think it's very tough to be health literate, even if you have the knowledge. Healthcare is very stressful and very emotional. And I think that's one of the things I see in kind of this new healthcare economy. It's that there is a return to handholding. There is a return to the navigator and the concierge and the nurse, the nurse who's going to help you through the process of medical management and get you to the right surgeon. All of those things are are proving to be the most effective way to get people to the right care. And so I think, yes, it's super important to be health literate. You have to be your own advocate, but also find trusted resources because when you're under stress, you need those.
Yeah, great. Well, excellent. Well, thank you again so much. It's been an honor. I look forward to seeing you at another conference. I know you are busy, busy, and again, just grateful for your time. So thank you for joining us today.
Fun to be here. Thanks.